Hello, hello, testing, testing. Hello, testing, testing. Good morning. Today is January 22nd, 2022. This is our regular Saturday morning yoga therapy class. We have been presenting in this class for a long time, initially in person, now virtually, and we have extensive experience using yoga as a therapy. All the sessions we do now are based on our experience of presenting yoga as a therapy to a large number of people who are practicing with a good outcome. One of the best outcomes we have ever seen in yoga as a therapy is for the senior people and for the two disabling conditions, one for chronic pain. Pain is due to tightness of the ligaments, tightness of the muscles, and yoga therapy is a relaxation response, activation of parasympathetic tone, and it is a wonderful practice to relieve chronic pain in the senior people. Next one we have seen is a wonderful outcome of a regular practice of yoga is restoring the balance. We all started losing our balance in our senior time. It's not that we are getting older, we are all getting younger, but still the losing the balance is a part of our daily living. You will see a lot of people in our age group, in our senior age group, they'll be walking very slowly. They'll be walking like a, they'll be sort of like a waddling, and they were going very slowly. Basically, it's a fear of fall. They fear that they will fall down, so that is one. Second, a lot of people will see they're using a stick in their hand, walking stick. Using one hand walking stick is not going to protect you from fall. In fact, it is a misnomer. If you really want a support that for walk not to fall, you have to use both the hands and use a walker. Yes, people always think, yeah, I'm fine with the one cane in my hand or one stick in my hand. That is not doing anything for you. In fact, you get more dependent. Mentally, you are going to fall more. Sounds totally opposing the ideas we have. Today's topic is yoga therapy for a better balance, or we call it a restoring a balance. Let me show it to you. Let me put this What does a better balance or restoring a balance means to all of us? In yoga, the health is defined as a balance of your body, mind, and spirit. And all of you who have been with this practice for a long time, you have seen we do a tremendous amount of balancing practices. Standing on one foot, closing your eyes, standing on one foot, doing the triples, Vrikasana, and doing a Kapalbhati pranayama at the same time, because it's a relaxation response. But beyond that, how to restore a balance, how to have a better balance. I have heard from a few of my friends who just mentioned we have to attend this session because we have started losing our balance. First, the whole disease, remember disease is D-I-S-E-A-S-E. In Sanskrit it's called a Ashuk. The disease due to imbalance between our right and left brain. We have two brains. Right brain is intuitive, right brain is female, right brain is cooling, right brain is parasympathetic. Left brain is analytical, left brain is male, left brain is heating, left brain is sympathetic, and we are also born with the dominance on one side of the brain. I'm right-handed, my daughter is left-handed. How do you know what is a dominance? The fine motor skill you do, the hand that is a dominant hand. If you want to put a thread on a needle, the hand you use, that's your dominant hand. The hand you write, that's your dominant hand. The hand you use to throw the ball, that's your dominant hand. Now you notice this, just to show you a practice, I was doing all using my left hand. I was putting a thread on the needle with my left hand. I started to write with my left hand. I was throwing the ball with the left hand, but I'm right-handed a person. So what does it mean? What it means, the basic balance will come from the morning to the end of the day when you consciously practice law of opposite and going against the grain of your habits. Nobody wants to hear this. Yes, that is your restoring your balance. So I'll show it to you. First, for me, I have a daily routine called Dinocharya. Wake up in the morning, I sit down. First I take a little time before I get up. I'll sit down in a squatting pose called Balasana. I will drink 2 glasses of water, like room temperature, sit down in the squatting pose for a while, and I will have a good sensation for a bowel movement, and I will have a very good bowel movement first thing in the morning. That is a part of yogic lifestyle. Then comes brushing your teeth. Consciously, I have been brushing my teeth with my left hand for a long, long time. Even I'm right-handed. So guess I tell you why. Because when I started doing it, my hand was all over. My hand was even not going close to the mouth. Slowly and slowly, my hand goes. I brush my teeth with my left hand. Guess what? My right hand will be doing like this. Because my brain has information called neuroplasticity. So I will be using my left hand to brush my teeth. Consciously, I will do the tongue scraping. Then when I take the water, I was to take all with the right hand, put the water in the mouth. I will use my left hand, put the water in the mouth. You will see that notice the difference. In the right hand, the cupping will be a lot better than the left hand because you're not used to it. But slowly and slowly with the practice, you will see both the cuppings will be equal. So using the non-dominant side throughout the whole day is bringing the balance back. Again and again. Going against the grain of your habit. Going against the grain of your habit. Practicing law of opposite is the restoring balance. Next concept, use both sides of your body equally at the same time. Example, when you're walking, put your right foot, then your left foot. Right foot, left foot. Don't walk right foot, right foot, right foot. Don't walk left foot, left foot, left foot, which I've seen a lot of our senior friends are doing it. Going up in the steps, you can hold the rail, you can do everything, but go right foot, left foot, right foot, left foot. Do not go only on the right foot, or left foot, left foot. I've seen lot of, oh, my knees are hurting, my knees are bothering. Go slowly, hold into the handrail. That pain in the knee you will be able to overcome. Going down is the same thing. Right foot first, left foot second. Right foot, left foot. It's a wonderful experience when you start doing it, and you'll see all of your balance will start coming back. Whatever you think in a day-to-day practice, use your non-dominant hand or non-dominant foot. I'm cleaning my table. As to use my right hand to clean the table, I'll use the left hand to clean my table. No question about it. I'll be cleaning dishes, I'll be using left hand to clean my dishes. And I feel very comfortable doing it. My left hand became, in fact, my left hand and right hand almost becomes like equal. And that's what you get the therapeutic benefit of practicing yoga. Same way, I'm sitting here, it's called Sukhasana, easy pose. I have my left foot, right foot. Within a short time, I'll change my foot. I'll sit down like this, which you have seen in a long, long time. And when you keep progressing this to bring the balance back, after this, as I said, in stages, I have been doing it for years, so I have no problem doing it. From this easy pose called Sukhasana, you go to Siddhasa. Put your heel all the way to the back. Try it. If you're doing it with me, you will feel a wonderful experience. Put your foot and the knees will come down. This is called your Siddhasa, perfect pose. Okay? What you do next, same perfect pose you do, opposite. Remember, I gave this heel here first. Now I go to my right heel towards my perineum. On the left foot here, and both of them will drop down. And generally what I do during practice, I stay in the pose for a long time, at least between 5 to 10 breaths, sometimes a minute, 2 minutes, or as long as I can stay here without any pain, without any discomfort. Next, to bring the balance back, I'm showing you what I do so you will understand what I'm meaning, bringing both sides, going against the grain of your habit. Next, I'll put in the top. This is half lotus with my left foot on the top. And many a time I will practice a bellows, Bhastrika Pranayama, on this asana, and you will see that slowly and slowly all the tightness melts away. Give you an example. Relaxation also brings your balance back. So this is an example. So we do a Jal Neti, use a neti pot every morning, sometimes if it is drainage. I'll use my right hand to separate the toes. Practice this. It's a wonderful practice. Use the left hand to separate the toes. I'm on a half lotus, and look at that. I'll be doing a very fast pace bellows breathing, Bhastrika, but for me it is totally effortless. What is effortless breathing? There will be no effort, means I will be able to talk. I will be able to even sing. And people call me all the time, you're a walking, moving yoga practitioner. Yes, all the yoga practice I do is totally effortless, because I've been doing. So here it is. I'm going to show you a little bit. I've shown you the last time also. A lot of people made a lot of comments. Okay, I just did 200. I can continue. I can continue for a long time. 500, 600 is absolutely not the issue. And I do practice daily. So that gives me my completely effortless breathing. Then what we are saying, we talk all about these practices based on our physiological parameter. Like here we have a health tracker. I have an Apple Watch. I can see all my health parameters and during my practice. So now what I'm going to do, I'm going to better balance. I'm going to bring the balance back. So I put my right foot higher. And I'm going to do another set of Bhastrika Pranayama. Remember, Bhastrika is called Prano Pradhan Pranayama. That means it brings the prana inside your body. Prana is your life force. Prana is a subtle energy which keeps you conscious, awake and alert. So bringing more prana will be the bringing more balance within your body and mind. Let me just show you just one set. Will you do about multiple sets of the hand raised? 20 slow, 20 medium, and 20 fast. These are all your practices for yoga as a therapy. When you start, do it very slowly. Always do it as if it is your normal breath. Always do it as if you can talk, you can sing during the practice. Very slow, 20. Bring it down and bring it down with a baby fist. Same way, when you do the balance, look at see. People will raise the hand like this. So bring the balance back, push your hand all the way straight, high up, as if straight. It's amazing. This will bring your balance back. Because you're going against the grain of your hand. Your grain of habit is raising hand like this. Going like this will bring the balance. 20 slow. Medium. Fast. One cycle of Bhastrika Pranayama. We do multiple of this cycle. But I'm talking, I'm breathing, I'm singing. All my lung is empty. I breathe out. Take a deep breath in. I can breathe more than 3 or 4 times in the normal breathing. But bring the balance back. I put my other foot high up. I'm doing a lotus pose. The balance will come to you. You don't have to push for a balance. You push for, again, the word. Put it in your mind and your brain. Law of opposite. Going against the grain of your habit is a balance. Same way you will see between two sides, you always have a difference. Called a Punamashkarasana. I'm going to touch my head to my knee. So I'm coming down as far as I can come down. I will come down and I'll stay. Remember, staying in the posture brings the relaxation. Generally, I'll stay between 5 to 10 breaths, breathing out longer than breathing in. Now with the opposite side, here I'm coming down in the opposite side, as far as I can come down, and I'll stay here. exhalation longer than inhalation, 5 to 10 breaths. You will notice clearly one side is easier than the other side. When the balance will come, you will know you have achieved the balance. Always practice using both sides of your body, both sides of your brain. Same way, you are doing, say, a spinal twist, Vakrasana. You'll be doing spinal twist and you'll be doing both sides equally. Balance is not going to come back. Yes, at the beginning, when you start doing it, what you can do, at the beginning, you can put a chair or going against the wall. You can just touch the wall, stand on one foot, then stay on the foot for a long, long time, 10 seconds, 30 seconds, 40 seconds. Then try to stand on with the eyes closed. So here, I bend, put my right foot against my left thigh. My left hand goes out my right knee. Right hand goes to the back. Left hand is touching the knee. Breathe out first. Take a deep breath in. Turn your body to the right side and stay in the pose between 5 to 10 breaths. So, what to do next? Same thing in the opposite side. Balance. Bring your balance back. And when you do in the pose a little longer time, you're hugging, you're touching your body. It's a wonderful experience. Hand goes to the back, touching my right knee. I'm doing the same thing. Turn your body away from you. Do with your eyes closed. It will be a wonderful experience. Balancing asanas, wonderful asanas called a Vaisasana, which is like a buffalo. This is the way how a buffalo will sit down. You bend your one knee, you put another knee in the top, and you're sitting down. In fact, you will feel so good, so relaxed. If you keep on doing it, you will do this thing without even knowing. Sometimes you sit down in a chair, your feet will go up like this. There's also got a Gomukhasana. Actually, we'll do a Gomukhasana, we'll show you, say, Ardha Matsyendrayanasana, spinal twist, but that will be showing the equivalent, you do equal on both sides. This looks like a cow face, metaphorically. So my left knee was on the top. Now I will get my right knee on the top. And I'll do it equally on both sides. Ardha Matsyendrayanasana. There is no English translation. So it says half Lord of the Fish pose, but it is the name of a rishi or a yogi. So you put your left foot here. It's a little bit more advanced than your Vakrasana, spinal twist. Left hand goes up here, right hand goes to the back, comes to the knee on the other side of the foot. Slowly turn your body to the right. Five to 10 breaths is good enough to bring the neuroplasticity, to bring the what do you call a habit form. Opposite side down. Same asana on the opposite side. And you'll always see your one side feels better than the other side. But by practice, by doing it, when you keep on doing it like probably me for some time, longer time, you'll see both sides will feel equal. I could even feel my one side is little bit more difficult than the other side. I'm a human being. I've been raised with my dominant right side. It is not going to be easy for me to switch over equal on both sides. There are few people in the world who are ambidextrous, but there are not too many people that always have a dominant one side of the brain. So if you look at Gomukhasana or a cow face, you will see that when you have a balance, when you bring the balance, it will be equal on both sides. So let me turn around so you'll be able to see what I meant, and you will understand what is the balance looks like. Here I am with my right knee on the top. My right knee in the top, my right hand goes high up. Left hand comes up, I put it in the middle. Hold your elbow, put it in the middle. The right hand will drop down, you'll touch it, hook it. Essentially, you'll be handshaking each other and you'll be comfortable. You'll be able to stay in the pose. You'll be able to talk, breathe, 5 to 10 breaths, able to sing in this pose. When I practice with my eyes closed and very quiet. But when I'm sharing my practice with all of you, I'm showing it to you that I'm totally effortless. Now we'll see the difference. Now I'm going to do opposite side. So in your mind, what you will do, any practice which you will be able to do, you'll be doing in the opposite side. So my left knee is in the left hand goes higher. The right hand is here. I stabilize my right hand. Put it in the middle. Left hand will drop down. You'll touch it, hook it, and essentially I'll be handshaking each other, and I will stay comfortable. I'm equal on both sides. Equal on both sides. I'm comfortable on both sides. How did this happen? Let me show you the practice, what I do. Some people notices it one time, but you might not have seen this. So here I'm in front of a laptop. Look at what I'm going to show it to you. I have this, I have a mouse, I have a keyboard, which I'm using. Notice my mouse is on my left hand. I'm a right-handed person. I'm a right-handed person, but I use my mouse with my left hand. And I've been doing it for a long, long time. It brings the balance back. These are wonderful practices I want to share with you, that the balance doesn't come back that easily. Next, another one is that you have to practice what we call getting up without a support. So when you are able to go a little bit higher. With this practice, you always brings your balance back. That you're able to sit down in a squatting pose. Remember squatting pose? Spine is straight, eyes are closed, your hands, fingers are separated. You are in a wonderful relaxation. Extend your wrist is relaxed. Put your one hand in the middle one. Slowly bring your hand. Close your eyes. Do your breathing. Breathing out longer than breathing in. This profound relaxation practice will help you bringing the balance back in your body, mind and spirit. Remember again and again, health is the balance of body, mind and spirit. Balancing your mind. Flexibility of the mind is the balance. Able to get up without a support. What is the flexibility of the mind? Flexibility of the mind is able to do different things at the same time. So I'm comfortable standing like that. So what will be my balance? Going against the grain of my habit. Put your both the feet together. This will bring your balance back. So what is a mental balance? People who have a mental rigidity, say for example, going to the same restaurant, sitting in the same table, ordering the same food they like. Their whole body will be in imbalance because mind controls your body. You have to go to a different restaurant. You have to like a different food. You have to order a different food to try. Same way, I always said, I love walking in the beach in front of the water. Nice, nothing wrong in that. Also try walking in a downtown, walking in a busy street. See what difference it makes. Same as you see, the balance back, and cross your feet. Crossing your feet, you will be able to sit down and you will be able to get up without a support. This will bring your health back. This will also bring your balance back. So how to bring the balance back? To the opposite side. Turn your feet on the other side. Slowly sit down and get up. Next, you'll be able to do it going all the way down into the ground and to get up without a support. By the time you're able to do it, your cardiovascular system, whole body and the whole body system stays in balance. So here you are, crossing both of your feet on the ground. Practice with me if you can. By the time you'll be able to do it, you are totally a yogi practicing wellness and enjoying a good quality life. From here, you'll be able to get up without support. If you put a one hand, you lose 25% of your health and life. If you use two hands, you lose 50%. Second, cross your feet opposite side and sit up. A lot of people tell me it is impossible. Impossible. I say, impossible is the word which is not there in the yoga practice. Yoga practice is called in stages, impossible become possible. So here I am, the opposite side, the same thing. I'm going to get up without a support. From here, I'm going to practice on my one foot. Now, if you're at the beginner, you can be close to the wall, put your hand, or you can put a chair in front, put your hand in front. So first you will do, your balance comes through your vision. Your balance comes through your inner ear. Your balance comes also from your hand. You'll see somebody is falling down. They always fall down in the hand. And they got a fracture in the hand. It's called a Colles fracture. So take your hands away. Do a prayer pose in the back. Like put your hands into the back. Slowly turn your hand like a prayer pose. And if you stay here, do your breathing out longer than breathing in, slowly and slowly it will keep going high up. What I do in daily practice, standing with a prayer pose to the back, and I'm doing the movement of my neck called Brahma Mudra, the 4 different movements, front and back, side to side, back, and the rotation. And I'll be doing with the bumblebee breathing like this. Or I do a Kapalbhati pranayama like this. I go from one side, then go to the opposite side. Do not practice pranayama standing up. It causes altered sense of consciousness. But I use the Kapalbhati pranayama standing up just to show the level of relaxation. So my hands are tied, But when you practice initially, you can touch the wall, touch the chair. I'm right-handed, right-footed. See if I can stand on my left foot. I stand on my left foot and keep on practicing. People who start initially, they call me, they said, oh my God, I cannot even stand even 4 seconds, 5 seconds, 10 seconds, 20 seconds, 40 seconds. By the time you're comfortable standing on one foot, close your eyes if you can do it. Initially it becomes almost impossible. I practice every day, still it is almost impossible for me. Practice it. Practice with me and you will see how it's not difficult. It is just the word should be quieting down your mind. You quiet down your mind, so you'll be able to do it. Same way, I'm using my right foot now. 10 seconds, 20 seconds, 40 seconds. Close my eyes if I can do it. Remember, people losing balance is a Parkinson's disease, neurodegenerative disease, spasticity. Yogic balance and yogic relaxation is the treatment of choice. See, are my eyes closed, one foot, I'm talking, I'm singing, that is the state. It's called yogic lifestyle. That is the state you want to bring yourself. My hands are in the back. You'll see another difference. If you want to practice say tripos, precaution, put your hand in the front and hand in the back. Let me show you what I'm saying. Put my foot below the knee. I'm putting it above my knee. My hands are in the back and I feel a different level of balance. When I put my hand in the front, it feels a lot easier. Put my hand in the top, it's even better. Then what you can do a little Kapalbhati Pranayama. Kapalbhati Pranayama is a state of the relaxation. Anulom Vilom Pranayama, the alternate nostril breathing, is activating both sides of your brain. For a proper balance practice, you'll see, I'll be showing it to you, alternate nostril breathing followed by a meditative alternate nostril breathing without closing your nostril. Here I am, my hands in my back, in a prayer pose to the back. I'm doing a tree pose on my left foot. And I'm doing a Kapalbhati Pranayama. Wonderful balancing practice. Same way, I may come close to the wall and I will be trying to get my feet high up as much as possible with a support so that I get some relaxation of my hip also. I'll hold my feet, I'll slowly get it high up, as high as possible, and I'll stay here. If I have any balancing issue, I get support on the wall. Same way, standing up, closing your eyes, doing your Kapalbhati Pranayama. What a wonderful practice. By the time you do it, this kind of balances, you are enjoying a good quality life. Same way, I'm holding this, I'm bringing it as high as possible, and I'm staying on this foot. A lot of other things, putting a head below your heart brings a balance back. Why? First, when you're trying to put your head below your heart, pressure inside the brain goes high up, called intracranial pressure. Pressure inside the eyes go high up, called intraocular pressure. Pressure inside your carotid arteries, or in fact all the blood vessel goes high up, called intracarotid or intra-aortic pressure. Our body is always in a state of homeostasis. That means our body is always trying to go back to where it came from. You know, people always say default mode network. Default mode network, very easily in stating, is that it is a reset button. You bring your computer, bring your television, it has a problem, it's not having, you hit the reset button. So by hitting the reset button, what is happening? My pressure inside the brain is coming down, pressure inside the eye is coming down, pressure inside my blood vessels are coming down. It is called baroreceptor sensitivity. That will bring the balance to the point that your blood pressure started to come down, your blood sugar will start to come down, you will get a profound level of relaxation with the activation of parasympathetic tone and the release of nitric oxide as a potent vasodilator to improve endothelial health. Remember, the whole health today, from all medical concern, all medical practices, boils down to health of your endothelium. Endothelium is the lining of your blood vessels. So here I am, I'm slowly putting my head down. I can come all the way down, separate my leg. It is a widespread forward bend. It's called Prasarita Uttanasana. I head all the way down, put my feet. One of my friends sent me this picture showing it how is a balance. He measured it by both sides, my head to both sides of the feet, and said it's equal on both sides. From here, you can practice a Kapalabhati Pranayama. For a man, it massages your pelvic floor. It massages your prostate gland. It's a wonderful practice for your prostatic hypertrophy. So, bringing the balance back in your daily practice, wherever you can use both sides of the body, use it equally. That will bring the neuroplasticity, that will bring your balance back. In a regular pranayama practice, you will be practicing again opposite of your normal breathing. opposite of normal breathing means, normal breathing is depends on our body type, whether we are Vata, Pitta and Kapha, but it's a inhalation, active inhalation, passive exhalation, and exhalation becomes shorter because it's passive. Remember, we have both muscles of inspiration and muscles of expiration. But we take a deep breath in, but when you breathe out, so practicing exhalation longer than inhalation is your balancing practice. Hands in a baby fist or yogic fist. Breathe out first. Take a deep breath in through your nose. Breathe out longer than breathing in. This is your balancing breathing. If you continue that throughout the whole day without any effort, you'll be able to breathe in even when you're sleeping. Exact word, going against the grain of your habit. Kapalbhati pranayama, as you know in pranayama practice, you push your belly button into the back. There is a balloon, there's a diaphragm, another balloon going up. It is an active exhalation, which is opposite of normal breathing. Normal breathing was an active inhalation, passive exhalation. In a Kapalbhati pranayama, which is also called a Agni Pradhan pranayama, it ignites your Agni, the digestive fire. It is active exhalation, passive inhalation. Just to show you one sample, I'm sure most of you have seen it because people who are joining it here, they've been doing it with me for a long time. So when I do the practice, my eyes, the spine is straight, eyes are closed, my all attention in the belly button. Paid no attention to my breath. My attention was here, pushing the belly button inside, air was coming out, active exhalation, and I was breathing in between inhalation passively without knowing. Why? Because when I was born, I took a deep breath in, nobody taught me how to breathe in. I have to learn how to breathe out. Most important balancing practice is alternate nostril breathing or Anulom Vilom Pranayam, and then the most meditative practice is alternate nostril breathing without closing your nostril. So this will be the practice. I'm going to show it to you as a balance. Then we will do a balancing meditative practice, and that will be probably the end of our practice today. Just to showing it to you how to bring or restore the balance. Health is a balance of your body, mind and spirit. Balance is law of opposite, going against the grain of your habit is a balance. From tomorrow, please try brushing your teeth with left hand. If you use your right hand to eat with a fork or a spoon, use your left hand to use a fork and spoon. I've been doing it for so long. My daughter is left-handed. My daughter looks at me and said, Daddy, you look like you are left-handed, everything you do. Alternate nostril breathing. You do a Gana Mudra or a Dhyana Mudra on the left hand. Use the right hand to close your right nostril. You don't have to close all the way down. Just close underneath your nostril. Breathe out through your left nostril. Breathe in through your left nostril. Close your left nostril with the ring finger and little finger. Breathe out through your right nostril. Breathe in through your right nostril. Close your right nostril. Breathe out through your left nostril. If you're practicing with me, continue alternate nostril breathing, and I'll tell you the benefit of this breathing. Left nostril is controlled by the right brain. Right brain is intuitive. Right brain is female. Right brain is cooling. Right brain is parasympathetic. Left nostril breathing is called cooling, or a moon energy, called Chandranari, or it's a parasympathetic tone. Right nostril is controlled by the left brain. Left brain is analytical, left brain is male. Left brain is hitting, left brain is sympathetic. Right nostril breathing is called Suryanari, sun energy, and also a sympathetic dominant tone. Alternate nostril breathing, it balances both sides of the brain. Wonderful practice to improve your memory and focus for dementia, Alzheimer's disease, for hypertension, balancing both sides of the brain in neurodegenerative disorders. Then you bring more focus in, and you're practicing it as long as you can, but generally 5 to 10 minutes practice when you can do it effortlessly. Then put your middle finger and index finger in between the eyebrows. This is called your Vishnu Mudra, and just focus on your third eye. Then doing a super brain yoga, balancing. Remember, balancing a super brain yoga. The left hand, hold on to your right earlobe. Focus is on your third eye. Then you do the alternate nostril breathing. Excuse me. So this is the technique. See, our nose gets so clean with your morning Jalneti and also with the pranayama practice. For a purist, we'll do it with also the left hand. So purist you'll do Dhyana Mudra on the right side. You'll use with your hand in the third eye. Right hand will be holding your left earlobe. you'll be doing alternate nostril breathing. Soon you will enter into a meditative state without knowing. So again, I'm changing my foot, changing my leg for my balancing practice. So end up with a balancing meditation practice, which is called meditative alternate nostril breathing without closing your nostril. Initially it feels like almost impossible, but it is not impossible. It is really easy to do. Touch your index finger and thumb, put it both over your nostril. First, visualize your breath. Do a breath-centered visualization of breath-centered meditation. Always remember, you breathe through your nostril. You do not breathe through your mouth. You breathe through your mouth, you have no idea where the air has gone in. Has it gone into your lung, within your stomach? But if you breathe through your nostril, it will all go into your lung. If you have to breathe through your mouth, you can always breathe out through your mouth. Breathe in through your nostril, breathe out through your mouth. Do not breathe in through your mouth. Many a time we use your mouth for different pranayama practice, like your Sitali pranayam, Sitkari pranayam, we do a Shankha pranayam, but those are all to use your mouth for a pranayama practice to cool down your body, to increase the resistance. Close your eyes, hands on the Meditation Mudra. Breathe out first. Visualize the breath in front of your nose. Visualize the breath is coming in through your nostril. Your nose is a filter. It is filtering all the dirt from your air which you are breathing. Your nose is your personal air conditioner. Outside air is warm, it is going to cool it down. Outside air is cold, it's going to warm it up. Air goes onto the side of your nostril where there is two ridges called turbinates. When the air goes through the turbinates, it creates a vortex, like a storm. This vortex rides over the mucosa of your sinuses, which opens in your nostril, and that mucosa releases nitric oxide. Nitric oxide is a potent vasodilator. It opens up your blood vessel, maintains your endothelial health of your endothelium, the inner lining of the blood vessels. Nitric oxide is also a mediator of parasympathetic tone. Other agents which mediates parasympathetic tone are cyclic GMP and acetylcholine, like your epinephrine and norepinephrine is a mediator of sympathetic tone. This vortex of air behind your throat goes directly into your larynx. Larynx will go into trachea, going into the lung, filling up the lower part of the lung, middle part of the lung, and upper part of the lung. You do visualize. Visualize the air is going behind your throat. It's in the upper part of the lung. lower part of the lung. There's the middle part of the lung, lower part of the lung, almost to the level of your belly button. The breath gets stopped automatically there, called cable kumbhak. I can feel after all this time I've been talking to you, my mouth is getting wet. That means I'm having a parasympathetic activation. I'm having secretion from my parotid glands or salivary glands. Visualize air is coming out from the lower part of the lung, middle part of the lung, upper part of the lung, behind your throat, behind your nostril, coming out through both the nostril. Outside the nose, it's picking up prana. Prana is not the breath. Prana is a subtle energy which keeps us awake, alert, and alive. Breath is the carrier of the prana. Metaphorically, prana is like electricity and breath is like electric cable. According to Ayurveda, our whole body does breathing, not only lung. Our liver is breathing, kidneys are breathing, my skin is breathing. So the breath takes the prana to the organ of healing. It's called the pranic healing. I have had a heart problem. I visualize the prana is coming to my heart through my breath and is causing the healing for my heart. People who have a back pain, they'll visualize the prana is coming to the back, getting relief of the back pain. People have diabetes, prana is coming through your pancreas to balance insulin secretion and balancing your blood sugar level. Then slowly visualize. Remember, I'm talk to you, but generally I do it in silence, with my eyes closed. Visualizing my breath on my left nostril. Visualize I'm breathing out through my left nostril. I'm visualizing I'm breathing in through left nostril. Visualizing I'm breathing out through my right nostril. Visualizing I'm breathing in through my right nostril. Breathing out through my left nostril. In your daily practice, you do with a silence with your eyes closed, and slowly you will see this practice will come back and slowly you enter into a meditative state. This practice for a short time in silence, alternate nostril breathing without closing your nostril. Slowly bring your hands in front of your heart chakra. Touch your little finger and thumb. Separate your index finger, middle finger and ring finger. Lotus Mudra, Padma Mudra connects your body, mind and spirit. Slowly bring the Lotus Mudra close to your heart with the side of the soul. Yoga practice is a balance. Routine daily practice, going against the grain of your habit and practicing law of opposite will bring the balance back. Always try to practice using both the feet, both the hands equally. Going up and down the steps, right foot, left foot, right foot, left foot, alternate foot. Going down the step, right foot, left foot, alternate step. Walking, right foot, left foot, alternate. Using left hand, if your right hand dominates, equally for every work you do. If you're left-handed dominant, using right hand for every work you do. Yoga practice is not mastering the asanas and pranayamas. Yoga practice is a daily routine. It's a lifestyle. Enjoying a quality of life, disease-free, medication-free, and quality living. It's not the quantity of life, it's a quality of life. Put your hands together. Namaste. I honor the divinity within you. And finally practice pumping and cupping. Rub your hands. When you feel the warmth in both the hands, if you're wearing glasses, you remove your glasses. Take the hands like a cup. Put it over your eyes like a cup. Let the eyes take all the heat from your hand. And slowly massage your forehead, massage your eyes, massage your face. All the muscles in the face and the forehead is attached to the skin. When the muscles are relaxed, the frowning goes away, the line goes away, the skin looks a lot more shinier. With your yoga practice, your tejas, your Agni, the inner fire starts glowing. It looks like you are glowing. Hands back, massage, earlobe, massage back of your ear, in front, even inside the external auditory canal. There is a branch called auricular branch of vagus nerve. It stimulates vagus nerve and it's a parasympathetic activation. Massage both sides of the neck. These are the organ called carotid sinuses. Massaging carotid sinuses has a profound, relaxing, calming down effect on your cardiovascular system and nervous system. We use carotid sinus massage when your heart rate goes high up, called supraventricular tachycardia. Bring the hand back, massage the insertion of your sternomastoid and trapezius muscle, which are both supplied by the cranial nerve. So cranial nerves quiets down, you get a profound level of relaxation. Wonderful practice. It is called yoga therapy, bringing the balance back or restoring the balance, and health is a balance of body, mind and spirit. So it was a wonderful practice, and I'll be here every Saturday unless I have another assignment, and I'm in, as I said, in a new residence, in a new city, but I have assigned yoga room and I'll continue the class from here. If question, please give it to me and I'll be able to answer for you. See you next Saturday.